If you have Peyronie's disease and you're wondering whether your age changes what you should do about it, yes, it does, in several ways that are worth understanding clearly. Let me walk through what's different at each stage. Peyronie's disease can develop at any age, but it's most commonly diagnosed in men in their 50s. That said, I see men in their early 30s through to their late 60s with this condition, and the presentation is genuinely different across that range. For men in their 30s, Peyronie's tends to present acutely. Research shows that around 79% of men under 40 come in during the active phase of the condition, meaning curvature is often still changing, and pain during erections is frequently reported. Multiple plaques are more common in younger men, and erectile function is usually well preserved at this stage. That's significant, because good underlying vascular health means younger men tend to respond particularly well to focused shockwave therapy during the active phase. The tissue is responsive, and the window to limit how fixed the final deformity becomes is very much still open. For men in their 40s, Peyronie's is the most common presentation I see in clinic, and it's often the most complex. By the mid to late 40s, most men have some degree of age-related vascular change that can compound the effect of Peyronie's on erectile function, one making the other worse in a way that needs to be addressed together. The psychological weight is also different at this stage. There are often long-term relationships, real intimacy stakes, and a great deal invested in getting back to normal. That context matters, and it's part of how we approach treatment. For men in their 50s and 60s, the presentation tends to be more established. The plaque is often more calcified by the time they come in. Erectile dysfunction related to vascular health is a more significant cofactor, and the healing response is somewhat slower. The realistic aim of treatment for an older man is meaningful, functional improvement and reduced curvature, and I'll always be honest with you about what's achievable for your specific situation, rather than offering vague optimism. What doesn't change across any of these age groups is this: acting during the active phase produces better outcomes than waiting. Non-surgical treatment is the appropriate starting point for most men at any age, and a proper assessment of which phase you're in, not just how severe the curvature is the most important first step. If you'd like to understand where your case sits and what the right approach looks like for you, a free, informal chat is the starting point. No commitment. The link is below.